I didn't go to college planning to be a doctor. In fact, I still remember a conversation I had with my mother in high school where she said, I think you'd be a good doctor because I always liked science. And I remember saying, absolutely not, I would never want to be a doctor. It just wasn't a goal of mine. And when I went to college, I started taking science classes. I majored in biology. And I always loved knowing how things worked. And I was trying to decide between doing a PhD and trying to be a scientist versus being a medical doctor. And I took the medical school entrance exam and did pretty well on that. And I started shadowing a doctor when I was at college, and I just really enjoyed it. I love the sort of people part of it. My father was a marital therapist for 40 years. And my mother was a psych nurse, a pediatric psych nurse at DC Children's, where I grew up. And so I was always surrounded by stories of people and relationships and their lives. And those two things kind of came together, sort of the science and the people. And so I ended up applying to medical school and got in. I had never been abroad before. And so before I went to medical school, I had gotten into med school, but they let me defer. And I actually lived in Europe for 2 years. And so that was a really interesting experience to try to learn another language. I actually learned French because I worked in Paris for a time. And then I was also a school teacher, which was a lot of fun, just working with students and coaching a bunch of sports before medical school. And I think it really helped me just mature. And you're on your own, you're making very little money, you learn to budget and be like a grown-up, before you go to medical school. And I think it made me more mature in the sense that by the time I went to medical school, instead of viewing school as just something I needed to get through, you sort of view it as a means to an end. That switch went off in me when I was working on my own, because you're sort of thinking to yourself, well, if I'm going to be a physician, this is the amount of time I get to prepare for that, and I better take full advantage. And then when I was in medical school, when I first started, I thought I wanted to be an orthopedic surgeon because I liked sports. And so I went into internal medicine. Of course, medical oncology is one of the subspecialties for that. And I had actually applied to do a general medicine fellowship and do some outcomes research at Massachusetts General Hospital where I was training. And about a week before the applications were due, I did an oncology rotation for the first time and just fell in love with it. Like literally by the end of the first day, I said, this is what I want to do. So I took my applications for the other fellowship, withdrew them, redid my applications for oncology. And I think I made it like just under the wire in terms of applying. And then ended up at Hopkins for fellowship, which was closer to my hometown. So trained there, and then I was on faculty there prior to coming here. When I was a medical student in residence, we would often have to be at work at 3 a.m. We worked 36-hour shifts. During fellowship, we also had long hours like that. And so I do remember after we had our first child, he was a very colicky baby, actually. So I would come home from a long shift, and many times we'd work 7 days a week or something. The baby would be crying, my wife would be crying, and my mother-in-law would be crying because the baby had to cry all day long. This is our first daughter. So that was tough. Trying to work in medicine when you're not able to sleep and you have an infant. It also can be tough to do academic work because I just find when you're sleep deprived, it's hard to do that sort of scientific writing and very complicated writing and things. Writing a grant, writing a paper, when you haven't slept in a few days, it just is very difficult to do those kinds of tasks. The bottom line is I have a lot of empathy for young parents and for people who are going through training. You're starting a family, but then you're also trying to accomplish academic metrics, and it can be very challenging. I have 4 kids, so it's been there's a lot of that for about 8 years. We had a baby about every 2 years, but frankly, I had it easy compared to my wife, and because she breastfed all of our babies, and that was really important to her. And so honestly, I was more like in awe of what she was doing than what I was doing, because she was also training as a psychologist, and getting through a lot of grueling things while having an infant. Of course, having kids has been amazing, and it really has been probably the most rewarding aspect of my life, honestly. And I've always felt that oncology teaches us that there really isn't a permanence to the world, and it's really more of a sand painting than a painting, and that's okay. It's nothing to worry about. I think that talking to so many people who are facing mortality and trying to help them through that just gives you a different perspective from really any other job. It can be really hard. Talking to a young mom who is not going to be there in a year, and she has young kids, and you get to know the family, and that's really difficult. But at the same time, it's incredibly meaningful to try to prolong that person's life, to try to give them access to trials, and also to learn from them. I don't think any of us can really know what it's like to have a life-threatening illness, or to know that you're not unlikely that you'll be here in a year. We probably can't really know that until you experience that, but being in that space with that person, I think, can be incredibly meaningful and has important lessons as to what's important in life and what are the things you should just let go. Outside of work, I really enjoy doing things with my kids. One piece of advice I often give to people as they are raising children is to be a coach. I've coached 3 of my kids in soccer, 2 of my kids in basketball, 2 of my kids in football, all recreational, by the way. I don't want to give you the wrong impression that I know what I'm doing with coaching, but I'm not doing it anymore as my kids are older and they need an actual coach, not me. One of the biggest advantages I found over the years is that you really get to know your kids' friends and their parents. Being able to spend that time, with my kids was also a lot of fun. And same with there's some volunteer activities that my kids do, so I do that with them as well. And like I was saying earlier, just try to be present, even if we're just driving in a car, listening to music, or finding out what's going on. Also, I play a weekly basketball game with the people who work here and some friends in the neighborhood, and that's just a lot of fun. I think, especially men, as they get older, can often get somewhat isolated, or really just do work and family and not sort of have those larger groups. And so it's so interesting to me how so many people who play every week and see each other every week, and you're just catching up on life and kids and what's going on, and so many of them have told me that's like their favorite hour of the week, just to do that together. And of course, you have to find people who don't care if they win or lose. And my main goal is to not get hurt. But it's fun. It's fun exercise, and it's just fun camaraderie, and to see even people you work with, outside of work, and do something fun together. So, for someone aspiring to be a leader in healthcare, I would say the first thing is to have excellence in your field that are important for leadership. And not to pursue leadership for leadership's sake, but because it's something that really clicks with you. I've often told people to pay attention how they feel in their car or during their walk into work. And how do you feel if you have a day full of meetings? How do you feel if you have a clinic day? How do you feel if you're going to a research meeting? And to really listen to yourself and not paint yourself into a corner based on some idea that you have. I want to be a leader, but if you hate meetings, that's a big part of leadership, unfortunately. And if you take things personally when someone complains about something, that's just a part of leadership. And you have to realize it's not personal. People are often frustrated with how something isn't working for them, or there's some infrastructure issue, but they're going to talk to you in a point. And if you run that piece of the infrastructure, they'll want to hold you accountable. So I think we all have to pay attention to what we really like doing. I like leadership because I like solving problems. And I find in academic medicine, you're surrounded by such brilliant people that who can do amazing things if you just let them do it and try to block and tackle the obstacles that they might face. And to me, the best leaders are the ones who are behind the scenes and just helping the faculty and the other researchers succeed. What I found over the years is sometimes there's different attitudes about that. Some people view leadership as a chance to impose their will and for their self-aggrandizement and success. And I flip that around. I really feel like as a leader, you should be helping all of the people around you succeed and do it quietly, but effectively. That really helps rise all the boats. You really see both patterns of leadership in academic medicine, and I think it's important to try to work at places where the leadership is trying to make things easier for all the faculty rather than the other way around.